So what we have to share is with you today is the the starting flow where the patient comes in from the booking, from the registration, and then we will take him to different departments. And what we are going to cover is today is OPD management, then the IPD, then the path lab, pharmacy, and then the patient will go out. And in those things, we are showing you the reports also. So Kiran, can you share the screen and start OPD management first? Oh, sorry, for the registration first.
Yes, sir. Hello. Good morning, everyone. Am I audible?
Yes, Kiran, you can go ahead.
Yeah. So this is our login window. So according to user role, we will give him access. For example, I am. This is our admin access. So when so this is our dashboard. We have around 22 plus modules in left hand side, like OPD, IPD, pharmacy, lab.
Okay, let's start with OPD. How do we do registration first, booking? So if a patient is a patient may, if a patient has booked from or through phone call or through website or through any source where they have to visit the hospital for whatever reason, so we are going to do OPD registration. Once now we'll see the patient is there at the reception, and we are going to do a first what do you call the registration. So there are counter. We have also inbuilt queue management. So you don't need to have a separate queue management for checking out the patients, which patient should go in which consultation. So on its screen itself, we will be able to direct patient to the respective consultant. So these doctors are put it in the masters through their skill set. Skill set is their specialization. So whatever in a multi-specialty hospital, if there are 15 or 20 specializations, so based on their specializations, the doctors are, they're added with their specializations. So now this patient name is Sagar. So he is going to. This is the registration form. So we are going to fill the form for registering the patient. So only the asterisk signs are compulsory. Rest they can skip it. In 8 seconds, we can register a patient. Okay, so now here we can directly create a where you can say iCard for the patient. This is the OPD consultation. These are fixed. You can give a discount based on their discount ledger. So every transaction is getting tracked in the system through ledger system. So whatever payment are coming, we are creating in the backend. There is a separate ledger for every transaction. So this can be taken through cash, check, credit card, or online. You can get the all details on the receipt. You will see the receipt. Show me एक receipt दिखा. Okay, now this is OPD registration receipt. So just show me the receipt first. So you get this receipt number. You get your doctor hospital's complete header where their phone number or what their logo, everything can be adjusted. This is rate, and here this is 01P. This we keep a track of every user's transaction, whatever the user is doing for particular department. So we are going to keep the track of every users also, and we have complete log of that user. So this is even in some hospitals, doctors don't want to do the EMR entry. So here we have this doctor can take a printout or a reception can take a printout, and this can be Kiran, little slow. Let me explain the things. So can you just open the OPD case paper? So this doctor can here write the complete case paper here. If a doctor is not using the computer or laptop, but if they are using a same system, they can fill the EMR everything online. Okay. Go ahead, आगे चल. So this is now done from the reception. ये क्या new patient report, okay. So एक minute. So this register code OPD. See, we have in there is an OPD number. This is the CR number which will be unique for every patient. Whenever the patient comes, he will be identified through CR number. Then this registration code. This is also unique. We can also put image of the patient also here if it is required. So then doctor name, receipt number will be there 44, because when a patient comes for an OPD, there is a separate OPD number, and when they go, even in the same day, if they have to go and get admitted, they have to transfer from OPD to IPD as per the norms. So they can see here also patient outstanding if at all is there. Now the reception role is done. Now the patient will go to the hospital, to the consultant. So now the doctor will do the login, or instead of doctor, the RMO will do the entry. So now that Sagar was admitted through register, he has been registered at the reception counter. Now the doctor see here, this patient here on this. Now he just had to do edit. His name, everything has been coming. Now status is pending. Still it is pending because he has not been, treated as of now. Wait. So we can also have predefined templates. If a patient is coming for a fever, or a cardiologist is there, so he has come for a just a follow-up visit. So we can have a predefined templates for the you can say RX. So the drugs will be same. So the doctor don't have to type anything much. So system अभी दिखा दे आगे चल. Okay. So now this EMR on the left hand side, you can see all these age, everything is coming here, OPD registration date. So the doctor will have this all EMR, we can configure it through masters. There is no fixed EMR like hard coded EMR. So because every specialization is different and every EMR is different. So based on their specializations, so this is gynec, I can see this is a gynec EMR. So we can change the whole EMR. So fill the EMR, Kiran, maybe few things, just chief complaints and all. So these are parameters, vital parameters. This can be also taken care of the reception if we have to configure it. So you must be knowing that there is a primary and secondary history. So primary history can be taken care of at the reception from the RMO, and then doctor can see all these figures already entered. So that flow can be also taken care. So we are just actually this I want to show them. This EMR also, as I was telling, so this can be, the whole body can be configured based on the different specializations. We can create opthal EMR also. We can create gynec. We can create cardiac. All specialization can be created here. These are all 10,000 plus ICD drugs which are there in the system. So through the system, you can also have these codes, ICD codes. So now on the same thing, doctor can prescribe. There are three things which we have. First is pathology, second is radiology, third is procedure. What in pathology comes, you must be knowing all the tests and investigations take care. So these we have all color coded path labs. So in show path lab only, just show in path lab. We have what do you call it? These color coding is, that means if the hospital is outsourcing few tests which they don't have that facility with them, so they can know they know that this test is not there, so that even we can put it on the reports that this particular test takes 4 days, 5 days, so the patient don't call them and say that whether my test is ready or not. So that is one thing. Just add a few tests, Kiran. do some CBC, do some urea, do some tests so that they will see. So I want to fill the report. Okay, now this radiology will be all radiology, like, my X-rays, what you can say, MRIs. So all scans and all will come under radiology. And this all we have interfacing with, path lab is interfacing with machines and radiology with the PACS. Then in procedures, we have like some doctor in ortho, they may need to do some dressings or they need to do some injections. So that also these services will be filled by the in masters when during the deployment. So those can be seen in the system itself that time. Okay. And we have this urgent and all test. So even if the patient wants to go for some surgery, so if we put urgent there, so the pathologist or the pharmacist knows that this patient is on the priority, so they will give them the priority so that the investigations can be taken ASAP for the further surgeries or whatever treatment they had come for, admitted for. So now show the give the RX.
Just one request,
Yeah,
Kiran,
please.
can you just go a bit slow, because when Rahul is explaining, you have already done that process.
Kiran, na?
Just sync with Rahul, Kiran.
Kiran, just go when I'm saying. So okay. So now this is RX. So this is all we have. We can take care of in these two ways. Sometimes the doctor, the hospitals have outsourced their pharmacy. So, but still for the transactions, because you must be knowing they have internal adjustments. So on the revenue, they share the the monthly payouts. So that also can be taken care. And if they have in-house, so this can be integrated with their pharmacy or with their inventory. So this inventory can be taken care through our system, through our inventory management, where the drugs with the batch expiring today. So those all features are there in the system. So which the drugs which are expiring today will be seen at the top. Which are getting expired, those I'll show you in the pharmacy module. So this is just a prescription which we have. So you can see dosages. You can see, Kiran, go back. When I tell you to change, then only change the screen. So this is medication name. This is dosages. We can have dosages. This can be also during the prescription. We can have what do you call it? In regional languages, we can give the instructions, advices. So that also can be taken care. So this is notes. Even the prescription can be taken out in 3 to 4, you can say 1 minute by the doctor, because if the doctor is busy with a lot of patients, so they don't even, once they get acquainted with the system, it is just a few clicks and the prescription is out. So this is medicine, start date, and now dosages. Okay. Now, I think we are done. Can you just show the, okay, now if we want the same patient to get admitted. So here you can see on the red on the left hand side, we will admit this patient, because we will show that this patient had come and we after he needs to be get admitted for some surgery or some treatment. So now show the all those report, save kar de isko, and then show the things what we have given so far. This is prescription. So prescription is there. So you can see prescription. These are the investigations on the same page. You can see the investigations, and this is the radiology. You can see this patient was new. Okay.
I have a doubt here, like a print language. How many languages do you have here?
See, it depends majorly, the hospital name and all, but whatever the content, as I show you, we can use Google Translator here, where the doctor want to communicate with, like in Maharashtra we have Marathi, so the advices can go in in Marathi, but the figures, the medicine name will be in the English only.
All right.
Okay, yeah. So Kiran, just go same way, just show that, okay, now this is visit summary, which they are going to put it in the file. So, okay, एक मिनट दिखाना, please show it again. So this is going to be filed. So all the vitals have been covered. This is diagnosis, vision. Okay, this is you are showing Kiran. I think this is
म्हणजे टीचरची इंग्लिश चांगली नाही दोघींची पण लय ग्रामॅटिकल मिस्टेक
Kiran.
करतात
Who is this? Ask her to mute, yeah. So this is, I think they have got this, what do you call that? Opthal, this thing. So you can see vision, near, distance. So this is a opthal doctor who has come. Chief complaints, diagnosis, prescription also had come down. Kiran, come down. So even this is a summary, whatever the patient has done from the registration till date. So you can see all those things in an OPD summary. So this can be also said when the patient comes next time, the doctor can see the history, whatever chief complaints were there, whatever diagnoses were given, all those things they don't need to go. They don't need to go to the file. They can see in the history also. This BMI will be automatically weight, height. Okay, Kiran, now this is fine. Now we are going to, now this patient is out. Now we are going to go again to the reception. Now this patient needs to get admitted. So once the patient needs to go admitted, so we need to again go to the reception. So the receptionist will see how many beds are available, what is the, that configuration is also required during the deployment. What we do is we make the hospital like ward wise, formulate the things like what wards are there, how many beds are there, how many, like in a hotel you do reservations. So show me, Kiran, the hospital configuration. Now, okay, this Saga D is there, his CR number. Now we want to book him. So now see, you can see on the left-hand side and in this screen will show you the complete hospital structure. So capacity, charges, category, and the name of that ward. So now we will see if we will ask that patient what is his choice, whether they want to go for a, based on their requirement. So we are going to ENT and ortho. So we'll send him to here. So you can see here, this all gives you a brief details of that particular bed. So which patient is admitted, under who doctor is treating that patient, and is it a surgery? S is surgical, is F and male, whether it is male or female, the sex is there, and then okay, then which is vacant. So now there are this you can see proceed for discharge. That means this is getting vacant and this is vacant. So now book Kiran, book it in the vacant this thing on the vacant bed. Now this is again very important part where we will do the we will admit the patient with the patient. We will see who is accompanying him and who is the responsible person under who is going to pay them hospital charges. So first we are going to do the booking registration. If we want a health card, now this is the person who is accompanying him. Also in here, we have given this, you can also take a photograph of that relative also. Save kar le.
So this is the case paper of that IPD patient.
This is the indoor case patient paper where you will see the patient as well as the caretaker. Now, patient name, you can come down, Kiran. You will see blood group, age, type, everything, whatever the patient needs to be filled with the doctor, who was the doctor, who is the reference doctor. Why this reference doctor is also there? Because we have a communication through the system itself. When the patient gets admitted, here the case is like the patient has come even immediately after OPD, but sometimes the patient comes on a particular date. So when the patient comes into the hospital with some doctor name that this XY doctor has asked them to get admitted, so an automated SMS goes to that patient, to the doctor, that your patient has been admitted. Generally, these doctors, the hospitals have to communicate with them. So we keep this, communication through the system also. Plus, if someone has referred So an SMS can go to the referral doctor also. Thank you for referring this patient. So they can, because they get some they get some cuts also for that, so that they can keep an accounting also here in the system. Okay, okay, now it's done. Kiran, show me to the next level. Now, when the patient is now admitted, we allotted him a bed. This is consent form. This can be in multi-language. The whole thing you can send, put it in the Gujarati, you can put it in the Marathi. Plus, we have also put it in a barcode. Sorry, fingerprint. Also, instead of sign, we can have a thumb impression also here. Okay. Now this patient has been admitted. Now what is the one? Now the one once the SMS has gone to the doctor, the doctor is now there in the hospital. So it is mandatory for any doctor to have a first round, first visit. So when the patient has been admitted and allotted a bed, that referrer, or sorry, the treatment doctor who is going to treat that patient will be doing the visit. So you can see Kiran is keep changing their roles so that you will not have this system seem to be look very, there are so many modules on the left and right. But when we configure it based on their role. They will see only 3-4 dashboards or 3-4 screens only. So they have to use only the part of their role. Okay, now here you see Sagar. So you can see these all are the users. So we have in one few hospitals, they have around 250-300 users also based on their roles. An admin can assign them based on their the access to their different users, the different features of the system.
So here we have to first confirm whether patient is come or
Acha.
cancel his admission. Yes.
Yeah, his Sagar hai na yahan pe.
Here
You have to confirm.
can confirm. Once we confirm, then bed will be assigned to Sagar.
Okay, now here, okay, wait. Now here also, once the patient is admitted, we generate indoor pass also for their relatives. Can you show the indoor pass? Indoor case paper also we have showed them. Indoor pass nahi dikhaya tha. Indoor pass dikhao.
Yes.
ये केस पेपर नहीं, इंडोर पास नहीं क्या वो?
Yes, yes.
Indoor pass. Okay. So this can be visitor pass. This is right now you can get it in the iCard dimensions, and you can get the access from this system. Okay. Now you can just show me. Just go to the first round, Kiran.
Yeah.
Now again, the doctor will go to the patient, and he will ask to do some investigations again, whatever it is required for the surgery or for the treatment here come. Doctor first visit. So right now Kiran has to do so many things because he is doing it, from various users, various models. Once the flow is predefined, so doctor will comes, he will see in his screen that these 3 patients has been admitted under him. He has to go for these 3 patients. He will click it and do the entries. So it is here, current bed. He has given current bed and all. Okay. Okay, one. Show me the now first round so that we can just do. Let's see.
The ENT and ortho general.
Any 400, yes. See, now you can see the color also. The patient who is getting admitted, and we have red color indicates patient whose first visit is pending. So the doctor can also see once he comes to the hospital, so how many patients are pending for his visit. So this color will indicate him that. Here, wait, patient. So here also you can see sometimes there are VIP patients. The color of that patient will change also here. If there is a VIP patient where we don't need to disclose the name also of the VIP patient, that also can be taken care. This is MLC patient. MLC will, like, where there is an accident patient. Then
Package.
okay, no, क्या है नीचे दिखाई नहीं दे रहा मुझे.
Package.
Package. So if it is an insurance or TPA under some insurance, he is getting covered. So that also can be taken care. Now show me to the first, and then we'll do this. Then we can send him to the OT or investigations. हमने क्या what we have to explain today.
CBC, pathology, radiology.
Okay. So let's go to that then. Then we can give them some time for question and answers if they. So okay, visit first. Okay, it's here again. So now do the entry, Kiran, again. So here it is, you can see this post, you can see the whole form. So you can, chief complaints, these are all predefined also when the doctor when the doctor will use his flow, these will be auto saved, and he just have to click, and it will come. So these vitals also, this can be done by the doctor or from the nursing station. करके ले ले and then save it. And this is now day-to-day charge sheet is getting these services. Doctor is using some services. Even the nursing station will show you the nursing counter also, where the doctor will instruct to their nursing station that this during 2 days the patient needs to take these much of precautions, these much of investigations or medicines. So that also will be taken care through a proper nursing chart from the system itself. So this is doctor first visit report. So this is chief complaints, this is family history, whatever is required for that particular patient, this is taken care, and we can put it in the digital mode, or we can take a printout and make a file of it. Okay, so Kiran, आपने वो दिखाया नहीं, you have forgot to show the the sticker generation for different files, anyways, we can show it in the path lab. So this is done.
Yes.
Okay, now what we can do and show it to, okay, now send it to the OT also, if we have OT module. OT रखा है तूने?
Yes, sir.
Okay. Then there could be second round, third round. So this all charge sheet will be developed by itself by the system. And when we are transferring that patient to OT, so we have OT management, OT scheduling. So in OT scheduling, you can schedule OTs, different OTs based on the doctor's availability and based on the these are the OT registration. So when we register a patient for minor OT, is it a minor, is it a major OT? So all those things, pre-notes, post-notes can be taken care from the system. Doctor can write pre-notes so that whatever is there for the patient has come for, and what are the post notes. So everything can be taken care from the system itself. This is first consultation history and admission. Okay, CR number is there. Okay, we have seen this. Kiran, can you just go to the OT? I just want to show them the OT form so that they will be
Yes,
able.
yes, sir. I am taking same patient for
Yeah.
OT.
Yeah.
So here,
So there is a proper SOP which needs to be there and maintained by the system. That's the reason Ashwini told me last time ki you can give us the login credentials. We would have given you, but when there are based on the hospital configuration, we provide. Some hospitals can't afford to have full protocol because of the different constraint, manpower or the feature or the more what do you call that, facilities they don't have. So we have to adjust it the way, because sometimes the software will not go out go to the next screen till the time you can say till the time the first visit is not done, till the time the OT clearance is not there, till the time the pharmacy don't give the permission to the clearance. So all those things will be easy only when we know the SOPs, and we have configured the way we want the system to work for us. So, and this is a very big ERP. So, sharing the credentials will not help till the time we know the flow of the system. Okay, now we are doing, okay, so just show me, no, Kiran, show me the form, that's it. So now you
yes.
can see in the form, so registration type is there. So we have patient name, CR number is there. Now this is again, add consent details. So without, we will see if the consent is not added, so the OT cannot be, taken place. So now with primary surgery is there, is it a primary surgery? So all the surgeries, can you just show me the surgeries? So there are already these surgeries are done from the masters, the database. So we have all these surgeries based on the standard protocol we have been, and these are the grades also. So you need to
Yeah.
know which grade is that surgery is. So, okay, niche aaja. And there could be multiple operations for that particular, like maybe they have to do one major operation first, then after that they have to remove second one. So they can perform 2-3 surgeries on same OT or for the same patient. Okay, come down, come down. So this is special precaution if some special precaution is there. So this is all clinical data which we have taken care. Now you can see OT consents, which language was the OT consent there, who has signed it. So all these things are there. You can just go to the next screen. If you guys have any, if you have any questions, you can ask me for the particular screen. So now OT is done. Now we'll show, okay, this is what?
Visit round.
Okay, that is fine. That will be similar to first round, second round. Now we will, if we have to do now in this only, we will do some investigation. So we'll have to go path lab. Okay, now we'll discharge this. Write a discharge summary now.
So just to remind, we are taking the registration administration part today, and we are also doing only the account and billing part, and how
Yeah,
lab and pharmacy is integrated. That's it.
yeah, so we are showing that once the patient is there, so now the billing will be taken care. Now, so the intermediate bill. So Kiran, do some surgeries and make a OT bill also, if you can right now. So then we'll show them the reports of accounting so that they will be able to understand what all things are getting covered. And apart from these things, if any of you must be sure that there are some forms, there are some accreditations like NABH is there. So for an NABH, they need to follow, a hospital needs to follow certain criteria and certain protocols. So those indicators out of, I think there are some, 90%, 95% of these indicators which can be taken care through system, through software, are covered in the system. So this is fully accredited NABH HIMS where you can take it. Now we have been also this system has been also now VASA accredited. That is, the Ayushman Bharat digital mission. So that also we have been on M3 level. Very few systems in India are now accredited with VASA. Okay. Now in this, the only thing which differs us with this system is this is there in this system there is no malpractice allowed. So in a corporate hospital or in a software where there is even a single till provision till the intermediate billing you can make the changes. Once the final bill has been printed or saved, nothing can be done to the billing. So we cannot change any of the investigations or any of the transactions which are related to related to the payments. So we get the logs. Yes, we can do from the back end, even for a couple of for admin only have the right, but that also needs that approval from the management. Rest, we cannot do any changes in the system. Even if a OPD wants to be cancelled after that, they have to refund the payment and show that this has been refunded. Or if someone has to give the discount, there are different discount ledger like doctor discount or charity discount. So at the end of the day, you will know how much discount has gone to which the ledger. Yeah, just save it. So this is visit charges. You get the whole summary of the bills, day wise also, total summary also. Generally, patients when they see the bill, they ask for why my bill is this much and what are the charges. So to keep the transparency, software gives them the day wise bill and the service wise bill, plus and one summary bill also. And if as I told you, we have integrated SMSs and emails. We have automated it in such a way that every night they get the notifications of their outstanding. Same thing we can send. There is a management reportings where the management will also get what is the total outstanding, how much is the IPD collection, how much is the we call them cost centers, how much billing has been done with various cost centers which are available in the hospital. So what is the TPA collection? How much is the TPA outstanding? So all those C's you can see from the system. So Kiran, can you just go to the path lab now? We'll just show them the path lab flow, and then we can show them the inventory thing. And we can just keep 10 to 15 minutes for their queries and question answer session. So this is path lab. So now when a sample comes through, we will come to know whether it has been come to OPD, from which different departments can give sample collections. So now we can just एक health collection. So sample collection कर ले एक. Now here pathologist will do the from his login we have been entered. It's okay. So now So now we are doing this. We had got a request from the doctor's cabin that these needs to be done, CBC and all. So we are doing it. So now how we are going to do it? So we have two ways where we can do the entries manually, or when we have interfacing with the machines, the data will flow through bidirectional or unidirectional depending upon the machine functionality. Okay. So किरण थोड़ा explain करो. Kiran,
Yes, sir.
yeah, please. अभी ये this patient was from IPD. So we have done CR number registration. Okay. So now these tests needs to be performed. The TAT is 20 hours. So this will come. Okay, now hemoglobin and okay, now CBS. So are you saving this? Okay, now what is this registration code CR number? Okay.
This is a barcode sticker for pathology sample collection container. You
Okay.
have to stick on
So while
container.
I cannot see the sample, can you show me the stickers?
Just a minute.
Okay.
It's visible now.
Yeah, it is visible now. So you can take a print of to the in the barcode printer, and you can stick to the test tube or that blood sample container. So you see the name of that. You will see the test, and you will see the department wise also.
So I have one query.
Yeah,
So
please.
now this is the area where the lab people is going to look into. So is Kiran logged into as a login ID from lab department?
Yes.
Yeah. You have separate. See, a doctor cannot perform this. Only a pathologist or the path lab department has the access to it. But when the patient, when a patient comes to the doctor, or when a patient comes at the reception also, and if the patient directly says he has come only for the investigation, he'll say I have to do this much of tests. You must have seen at the hospital they give them a small paper where they have to tick the test which they have to go, or the prescription directly they hand it over to the reception. So the receptionist can also enter the test name, and that those tests will be seen in the path lab department कि ये patient का sample पहले sample collection होगा. When the sample collection is done, or a urine sample has been collected, that can be that data with this barcode name will be taken care and put it on the container. And sorry, after the sample has been collected, this data will be there on that, and path lab will see ki, the sample has been collected. They will give it for the processing. When the test results will come, they either if the if their system is not integrated, they will do the manual entries he will show you right now. So, or if the machine is if there is a machine interfacing, the parameters will flow automatically in the system itself. Yeah, see here, sample number, CR number updated. And we have this, what you can do is, once the test has been ready, it will directly, a pathologist can see, put a digital, he will see the, till his approval, it cannot be given for printing. So he can do it, remotely. If he's accessing the system, he can see the reports and then, approve it from his digital signature and do the approval. Then only the result can be printed or given to the patient. That is one part of it. Second part is, if they see here, second part is this is normal range, different tests, whatever. This has also come from the masters. So this we have everything in Excel. So we'll upload it from the backend, and it can be seen for various hospitals. They have different way of showing the report, so that can be taken care. This is again a module where we can do complete we can dynamically configure the system as a just last time I was told you that this system is getting used in KIM Mumbai. That their path lab is totally different from the standard path labs. They are only doing those tests which are rare, and they do R&D on those. So their reports are also totally different. So it took us 6 to 7 months to configure their reports only. The procedure is same, sample collection and for the processing, and they have interfaced few machines from with our system, but their reporting structure is totally different. So we were able to do it because our whole system is dynamically designed. So okay, this is results. Okay, Kiran, dikha kar de jaldi, and then show me. You can put notes also. This is the in the pathology department it can be done, and then once it is unapproved, status is unapproved. Okay, now this is the technician who is doing the from the lab. नीचे आया sign उसका एक मिनट Kiran, can you should know? Okay, so now this is done so far. Now when the pathologist will approve, now see you can see this is 10. So unka it will be like the standard one will be the bold one will be those which are not in the range. Okay. Now once we give it, once the pathologist approve it, and then we can send it for approval. So a pathologist, if they are working, they can access it from anywhere and give it for the approval. Okay, Kiran, this is fine. So the process is like that. So you got it now. So if there is, okay,
This
now,
is fine. It's understood that how path part or path software works. So we can just move ahead for billing at the end of the day once the patient gets discharged and all. Or I think we have all covered the topic which we have discussed.
yeah, I think we have covered. Now, I would like to show some reports, what I had asked Kiran to show. Kiran, go to the report section and show them the reports. So that, see, this is daily collection. So we have all the filters. So you can check, it's not like, we have some predefined. So you can put filters consultant-wise, service-wise, department-wise, consultant reference document-wise. So you can do all the reports which are in whatever the patient, the transaction has been done from and to date. Kiran, can you show me some reports of, yeah, show me. Charges also, like, in hospital they have, nahi, ye change karna, ye service name change kar. Service name will be something different, na? Drop down में जा.
No, select नहीं किया है वो.
अच्छा, ठीक है. एक मार्च से 23 मार्च पीछे पीछे
हाँ.
का तूने चेंज किया ना, चेंज करो.
नहीं, ये बैटिंग पे है.
I was telling last time, I think 2 days back only to Ashwani, that it is better, if you have some doctors or who are looking for some software where we can present those, this system to them, and it will be easier for them to understand, and we will also get some confidence, because we were doing the same thing for Tata Communications. So when we were in, in some association part, so they had got some few clients from various parts of India, and then we showcased them this product. So that also you'll have an idea, because already we have a huge customer base, and definitely this system is there since many years. So that is the reason why these hospitals are using since many years now. And those hospital names are also very, much renowned in their industry. So if you see Dr. Hedgewar Rugnalaya, so this is 350 bedded, where the OPD count is huge daily. So they can see the reports.
So this is a service-wise report. Casualty consultant count is 1, amount is so and so. We can also
Doctor wise.
consultant-wise. We have consultant-wise report also. So Dr. Arati Bang has 3 patient count and amount is this.
Okay. So if you have any queries or questions, you can please ask. Ashwini?
Okay, so we have done for this. So Padmashri and team, I hope this is now quite clear for every one of us that how this ERP system of hospital management works. Now, of course, as Rahul said, it's having more than 30 modules, so we cannot spare that much time. But at least with this overview, I hope it's very much clear to each one of us how this ERP system works. So if anyone has query, we are always open for next 10 minutes to discuss questions and answers, please. Yes, team.
Just one question. So, in terms of GL bookings, finance bookings, I have seen that whenever you have an OP or IP bill generation, how does it happens at back end in terms of finance? Where do we see the bookings? To which account it is going to be booked?
See,
So, where can we see that, and what is the setup behind it?
so you mean to say that admin, so they have the reports. So once you log in from your admin credentials, so you will
Uh-huh.
see how many total patients have been admitted so far. Because if you've seen that they can see in department wise also. So how many patients are there in the OPD department? How many are in their X-ray department? How many are there in the how many patients have been admitted in this ward? So they see, and how much is there collection, advanced collection collected till date. So admin can see all those reports from the system itself. So those reports are there. So you can see that even for the management, I told you we have total reports where they can check each and every part of transaction which is happening live. Sorry. So they can configure their dashboards, and even they don't have to go into the reports. They will just click the dashboard what they want, and we can give that dashboard for them so that they will be seeing the live data. So doctor wise also, ward wise also. So these are the reports they can check. So I think this was your question, right?
Yeah, it's basically in terms of accounting, actually. I'm asking
Yeah,
purely
yeah, yeah.
from
So
financial reporting.
in terms of accounting means you want to see how much, what is the collection, say by 10,
Yes,
12
yes,
o'clock, what is the collection
yes.
for OPD department? How many patients has been come? So not only the department wise, we can tell you the doctor wise, we can tell you, because see the data we are collecting data from all over the different windows. So you have the access to the data, and whatever you want, we can use the customization also. So you can see uh, this is okay. This is the graphical representation, but the actual count we have shown you. If there are different filters, you can keep it, and we can configure this particular dashboard for you. For OPD separately, how much is the admission? how much was the, how many was the, what is the bed occupancy. So you can do all these, we can customize. We have 63 dashboards. So 63 dashboards with for various departments. For as an admin, you want to see, as for an accounts person, you want to see what is the collection. So he has shown you the collection department wise also. So anyone else? Ashwini?
Yes, Rahul. Okay. So I suppose the topic which Paul was asking was already shown by Kiran earlier, but I think it was too fast. But yes, Paul, as you said, these things can be done at the back end also by the admin person. Rest, any more questions from the other participants?
We have this collection data. You can see collection data. You can see, we have actually this whole system has been divided into two segments. One is clinical data. Second is commercial data or financial data. So, sorry, you get both the data. Now, initially it was only commercial, financial data was required, but now even the clinical data also, you can do drug analysis, you can do disease analysis. In financial also, you can see which, say for an example, pharmacy, most running drugs, what are the most running drugs. So you can do the projection based on that. You can do also supplier wise, you can give rating to your suppliers, what was the price which they supplied to you in whole year and what was their average price hike. So you can give them the rating. So that is a part of where you can control the pricing, where you can control the operations also, and checking out these backend. See, this the whole backend is in SQL and the front end is in MVC and ASP.NET. So the SQL is the most secure right now because there are a lot of huge transactions which are going through the system. So there are passwords. This is all password protected data. So no one can have access to that data wherever you wanted to keep it in the secret. You want to keep it in the security. So as you said, admin, you can see the reports because this is live data. It is getting saved on your own server or on a cloud. So you can see the data because if you remember, I have told you in the OPD, we have this ticket token system. So when a patient gets enter, his name is can be seen on the screen. When the doctor the doctor sees the patient, it goes automatically out of the screen. So that means it is, you can see the data live in the system.
Understood.
Yeah.
Others, yes. Naveen, Priya, any questions? Padmashri?
We have audit system, there are a lot of things which are there in the system. It takes generally, if we see, that's what I was telling Ashwini, if see, there is no doubt this system is one of the best. I am telling you, which we know because of their customer. If you have, if we start working on the, sharing this product to different of your connects who are into healthcare and who needs this system, so we can and know their requirement, how many modules are there, what is their bed size, what is their strengths, what are their strengths. So we can configure the system what they needed. And definitely once you also get confident that this, when they see the system and will compare it with their existing, we have more than 80% of their conversion ratio when they see the system. Although we don't give this system, we don't show this as you are seeing the system, the entire modules. We don't show them to them because then they ask for whole system for very less amount, which we cannot afford because there are a lot of implementation charges. There are a lot of we sell this whole system for 91 CR also. We have so based on their requirement, we configure the system and then show the system to them. So a 50 bed may not need all the SOPs which are 500 bed or 200 bed or 100 bed required. So we will not show them because when you show them everything, they want everything. We have a mobile app also. It is similar to you can see Apollo hospital app, similar to that. So likewise, we don't showcase all those things to a hospital based on their requirements. So what I suggest, or what I feel, that you all have vast experience in your fields. So what I feel is, once you have this product with you, Ashwini and me are working now since from last 1 year for different projects. So what I feel is, once you have some prospect, so as a team we can showcase them the product, and we will configure the same system for them, and definitely it will help us to get business together and grow together.
Sure. So with this note, I think we are good enough to understand this ERP. And if you have any queries, let me know. I will convey to Rahul and team. But yes, as Rahul suggested, we are looking forward to show the demo to other clients. So it will be really good if we have the client in our next meeting, and that will be more understanding as per their requirement how the system would work. I think with this note, we are good enough to close the session. Any more doubts from the team, or any explanation on any topic from us? Yeah, Padma.
And if you need any marketing brochure or the feature list, we have a very nice product for IVF. So that is a standalone, it doesn't, because it is one of the best, because not one of the, I'm saying, because it has, now the IVF centers are coming up left and right in India. And we have already been giving product to our, the Apollo chain. So they have already using our, software for 16 centers, and they're coming up with 100 centers. So we have a complete, this is just for your information so that you can pitch it accordingly. So we have a end-to-end solution for IVF centers, where they can track each and every transaction of their, flow, where they have to keep their cycles in the IVF process. So it's a purely clinical system which we have created. We had created for Indira IVF first, but somehow it didn't work out with them, because they wanted our source code also, which we were not ready, or So then the system is ready, and then Apollo has taken. Then the IVF CMO got transferred to Apollo, and he got it there. So we have that product also with us. So even that also can be a good, good product, good product to start. This is again a healthcare product only, but now the India has coming up with a lot of healthcare IVF centers, and with different various names. So this was just for your information.
Correct. Yes, so thanks for that upcoming latest news from our software. Thanks, Rahul. So I suppose we are good enough. So can we take a leave? Rashmi, Priya, Navin, Paul, Padmashri.
Yes, ma'am.
Thank you so much for your time, and have a nice weekend.
Yeah, thank you, team. It was
And
good.
I'm
It was
looking
good
forward
enough.
from your, looking forward from your, from your,
hear from you that we are working with some client. Yes.
yeah.
Yeah. Thank you, Rahul, and
Thank you so
Kiran,
much.
for your time.
Thank you,
Yes.
Ashwin ma'am. Thank you, team.
Thank you. Yes.
Thank you, Rahul. Thank you, Kiran.
Yeah.
Thank you, ma'am.
Thank you.